Alright, we're here with Michelle. Michelle's here today to be evaluated and treated with Kybella, a new product for submental fullness under the chin. So Michelle, how old are you?
I'm 46.
46, okay. And have you ever been bothered by a little bit of fullness under the chin here?
Yeah, I noticed it in photographs, and regardless of exercise or my weight, it's always there.
Okay, and is it something that you've noticed on more than one occasion throughout?
Yeah.
Okay.
Yeah.
And have you ever considered doing like surgery for it, or was it never bad enough that you would have thought about having surgery?
I guess I thought about it would be nice to do something. I don't know whether liposuction or something about it, but I've never acted on it.
Okay, so obviously it's a little bit of an incentive to you to have an option now that's
Yeah.
easier, right?
Oh yeah.
Perfect. So that's one of the things we're excited about too, is there are so many patients like her that would love to do something but don't really want to take the downtime or the additional risk of surgery. So what we're going to do for Michelle, we've already applied some numbing cream for her. Now what we're going to do is actually draw some of the really key areas of the face that we want to watch out for. The first one is the jawline here, so we're going to just draw the jawline so we know where the bottom of her jaw is. And then right below that, about another centimeter, we're going to kind of mark out a safe zone where there's a few nerves and other things that we want to stay away from. And right underneath here, you'll see there's a little natural fold we call a submental crease, and that's really where most of the fat lives, right here. We want to treat all of that fat, but we kind of want to stop down at what's called the hyoid bone, which in her is right about here. So we mark the hyoid bone, we can feel it right there. Everything above that is fair game to treat, and we're also going to mark the edges of the fat here that we want to inject. Okay, now what we're going to do is apply a little tattoo template to the skin just to help us figure out exactly where the dots are going to be for treating the neck. So we apply the tattoo there in just a little bit of cold water. Sorry, Michelle, this will run down your neck just for a minute. This is just like those little temporary tattoos that you use on your kids for Halloween or whatever. Okay, we'll give that back to you. So now when we peel this off, you see a nice serrated dots. Now I'm going to go ahead and start injecting the Kybella. It's important that you just hold really still. You shouldn't feel anything, but if you do, let me know, and we'll pause, okay?
Okay.
Okay, there we go. So we're going to inject 0.2 cc's in each location, right next to the dot. We don't like to go through the dot because we don't want to inadvertently tattoo the skin with the little ink there. How are you doing?
I can't feel anything.
Great. I'm kind of pinching the skin a little bit just to make sure we're getting the product right where we want it in the fat only. We don't want it too close to the skin or too deep either. So it's sort of in a perfect plane between the skin and the muscle. And pinching also helps me to keep track of where I was, which dot I left off when I pass off my syringe. That way I don't lose my spot. Still doing good?
Mm-hmm.
Alright, we're almost done. Okay, that should do it. That's all the syringes we need. So, how was that? Did that feel
I couldn't feel anything.
good? Great. That's what we like to hear. We're just going to get you cleaned up here and put a little ice on.
Okay.
And then we'll advise you a little bit on resting tonight, no exercise for a couple of days. And you'll experience a little bit of discomfort possibly later, but since I injected some long-acting numbing medicine, you shouldn't really feel much. We'll ask that you also don't lay flat tonight because that might make it swell a little bit more.
Okay.
I think other than that should be pretty user-friendly and easy from your standpoint, okay?
Okay.
And then we'll reevaluate you over the next week or two and probably do a second treatment in about 4 to 6 weeks. Next treatment you won't need as much product, and so the recovery and swelling and everything will be a little less as well.
Okay.
All right, good job.
Perfect, thank you.
Thank you so much. All right.